basically my job here is to conduct researches and give training to the researchers, conducting trainings, although not all part of it, but I'm moreover involved with the documentation of all the research activities and all the project activities here at TPO. Yes, and I'm also leading a research on perinatal depression, I told you earlier, and also if there's some short-term research projects, I help them in developing the tools and writing and the data analysis and stuff. Compared to the past, I'm really happy seeing the changes because just like if you see, if you compare the situation a decade earlier and now, there are a lot of changes. And yeah, in case, so the changes are basically, although in not all the part of Nepal, but some changes have been made. And with the introduction of research, long-term research projects such as Prime and Emerald, I can see a better future for mental health in Nepal because there was almost nothing in rural areas in terms of mental health services. But now, with these projects, we have been training health professionals to provide at least basic mental health services to the community. And the best part is, like, they don't have to travel a long way to get those mental health services. They can access mental health services in their own vicinity. So of course there are changes, there are positive changes, and I'm hopeful for better outcomes in the future. And regarding the challenges, basically these large projects are currently run by NGOs and private organizations, but when it comes to health system, the government system, mental health is still marginalized. If you look at the budget, only nominal amount of the total health budget is allocated for mental health. And so from the government level, the efforts is not like so convincing, but it's a good start because they have come to know the importance of mental health. And maybe, hopefully, when these two projects phase out, I hope the government will be able to prioritize mental health in the health system. So right after the earthquake, TPO Nepal actively involved in developing human resources in psychological and mental health field in Nepal. So immediately after the earthquake, right after the earthquake, we sent a team to one of the hardly affected districts, earthquake hardly hit districts, and we organized a health camp there. And simultaneously, other staffs were actively involved in building capacity, local capacity, to provide at least psychological first aid to the community that were affected by the earthquake. So immediately after building capacity of the local communities to provide basic services, we then based on the IASC pyramid, which stands for International Agency Standing Committee. So based on that pyramid, we organized our activities. When we had done enough of building resources for psychological first aid, we then sent out our community counselors at the earthquake affected districts so that they can deal with those people who had long-term symptoms of psychological symptoms. So they were basically involved with providing individual, family and group level of interventions, counseling services. And also after around 4 to 6 months after the earthquake, those who had like persistent mental health problems, we plan to integrate mental health services in the district level so that they can access the mental health services at their own community. And so this earthquake was an opportunity for us in terms of scaling up mental health services, because the government was also very willing, and since the earthquake unleashed many mental health problems, so the integration of mental health mental health services could advance in the community level. So so I think it is in 4 districts we train the health workers, and now we have integrated mental health services. And simultaneously we also prior to integrating mental health services in the primary healthcare centers, we conducted need assessment study where we assessed the mental health needs of the community people, and based on the findings we designed a culturally appropriate mental health care package and integrated in the primary healthcare centers.